Welcome to the musculoskeletal and wound module of this series. Now, the material in this area makes up 13 questions on the CEN. So, knowing that you are going to have 150 questions counting towards your final score, 8.5% of the questions come from this area. So, let's start the way we've done in every other module, and that's with a challenge question. Here we go. A traction splint is applied to the leg of a patient with a femur fracture. The appropriate amount of attraction to apply is best determined by A. Visualization of the leg length, B. Palpation of the fracture site, C. A radiograph of the affected limb, or D. Measurement of the patient's pain. Now I'm going to move on, but if you need to, you can pause and think about that question a little bit. So let's just start by talking about a few definitions that may be helpful for the exam. Ligaments and tendons. What are they? How are they different? Well, a ligament is a bundle of connective tissue that binds two bones together at a joint. Every joint has at least two, if not more, ligaments that hold the joint together. Now, if you injure your ligament, you have a sprain, S-P-R-A-I-N. A sprain is a tearing injury of one or more ligaments leaving a joint unstable. The problem with sprains is that a lot of your ligaments do not have really good blood supply, and they may have a bit of a slow healing time on them. Now, a tendon is a fibrous structure connecting a voluntary muscle to a bone, cartilage, or ligament, and they allow muscles to work. If you injure a tendon, you have a strain, S-T-R-A-I-N, and it's a tearing injury to muscle fibers resulting from excessive tension or overuse. So, as a quick review, a ligament holds bones together at a joint, and if you injure it, you have a sprain. A tendon holds a muscle to its attachment point like a bone, and if you injure a tendon, you have a strain. Now, a couple ways that I remember these. Tendon starts with T, and strain has a T in it. That might help you remember the difference. Or another thing to remember is strain contains the word train. And when we work out, we train our muscles. And a tendon holds a muscle to its attachment point. So, I don't know if those help you remember the difference between a sprain and a strain, but I'll give them to you all the same. Now, sprains and strains can be classified according to the severity of the injury. They can be called a first-degree sprain or strain, a second-degree sprain or strain, and a third-degree sprain or strain. Now, a first-degree strain is going to affect a muscle, or the attachment of the muscle to the bone, and it's going to cause that to be stretched and pulled. But it still remains intact. So the muscle itself is still able to function. There's still stability of the area. Now, if it's a first-degree sprain, it's going to be pulling the ligaments that hold the joint together. But the ligaments remain intact. It's just that the ligaments have been pulled and they're stretched a little bit. So they still hold the joint together and they still keep the joint stable. So if a patient comes in and they have a first-degree sprain or strain, they'll usually be able to use the joint or muscle. They'll be able to bear weight on it. Of course, it could be painful, but they'll be able to bear weight. Sometimes the swelling and bruising may take up to 24 hours to develop in these minor injuries. And typically we do nothing more than encourage the patient or we put a compression dressing around the area of the injury and encourage the patient to rest it and put ice on it until the pain and swelling go down. Now, a second-degree sprain or strain is, of course, a little bit more serious. In this one, you have a partial tear of the tendon or the ligament. Now, the joint or muscle will still be intact, but because there's a partial tear, there is a risk that use of that limb could cause the partial tear to become a complete, and then it becomes a more severe injury. So we want to treat these a little bit more carefully. Patients with second-degree sprains or strains will have obvious ecchymosis to the area. pain that is present at the time of the injury. These patients will likely require a splint to be applied to the area to give stability to the either ligament or muscle and to reduce its use so that it doesn't completely tear. And these will require a longer healing time and a PT referral. Now, a third-degree sprain or strain is complete. Either the ligament is completely torn or the tendon is completely torn, which means that the joint is open and unstable or the muscle is no longer attached to its point. That means that the joint or muscle is completely unstable, and any use of it could result in the bone ends coming apart and not being aligned any longer, and it could cause damage to other structures as well. So it's a complete disruption. Now, they often have swelling with this one that's present at the time of the injury. The patient may describe a snapping noise at the time of the injury. Now, again, because of the instability of the area, the patient's going to need an application of either a splint or a cast to keep the bones aligned, and so they don't use it and cause, the instability to be worsened. It will often require a surgical consultation and many times require surgery to repair the joint or the muscle and then a PT referral.